Welcome to the Neomedical instructional video for the modified Seldinger technique for insertion of vascular access devices in the neonate, infant, or small pediatric patient. Modified Seldinger technique is commonly referred to as MST. The first step is to gather the supplies and equipment required for insertion of the selected device. This includes the MST kit. For this video, we will be using the 27 gauge introducer needle that comes in the kit. You may also use other small peripheral intravenous catheters that you are familiar with and commonly use for peripheral vascular access. Once the infant has been appropriately prepped and a maximal sterile barrier and sterile working field have been set up, open the peelable pouch and drop the MST components on your sterile field. Next, remove the covers from the sheath dilator assembly and the introducer needle and pull the atraumatic tipped guide wire from its holder 2 to 3 centimeters. Once the equipment is ready, perform the venipuncture at the previously selected site. Once you are confident that the needle is seated within the vein, thread the soft-tipped atraumatic guide wire through the needle, ensuring the wire is threaded beyond the tip of the needle 2 to 5 centimeters. At this point, you can remove the needle, being careful not to dislodge the guide wire in the process. If you are unable to advance the guide wire, remove the needle and guide wire as a single unit. Never retract the guide wire from the needle, as this may cause damage. Though we are not using ultrasound to guide our insertion in this video, the use of ultrasound has become a standard in many units. The sheath dilator assembly can now be thread onto the guide wire. This can be tricky due to the small size of the dilator and the guide wire, so be patient. If you have a second person helping that is sterile, this would be an appropriate time to have them secure the guide wire at the insertion site while you use both hands for threading. Once the sheath dilator assembly is threaded onto the guide wire, it should be advanced into the insertion site and vein without much resistance. Though not common, if significant resistance is met at the insertion site and the dilator isn't advancing through the skin, a small skin nick may be necessary. With the sheath dilator assembly in place, remove the guide wire and dilator so just the sheath remains in the vessel. The vascular access catheter can now be threaded to the desired tip position. Once the catheter is threaded to the desired tip location, the sheath can be peeled apart and removed, leaving only the catheter in position. Thank you for watching this instructional video on the modified Seldinger technique. If you have any further questions or would like additional education on this product, please reach out to us at neomedicalinc.com.